This government's big idea on healthcare was universal health insurance. I've worked all over Europe on different health systems. I don't think this is the right model to finance our health service in Ireland, and I think that it takes from the failed playbook that the government used to approach Irish water. And so what is universal health insurance, and why do I say that about Irish water? Well, there's 5 reasons. So the first is that universal health insurance would basically make everyone pay for health insurance, and it takes that out of general taxation and into a charge for health insurance. And so in my view, this transfers the burden of paying for our health service from the rich to the poor, because you're taking out of a fair tax system where the more you have, the more you pay in. The second reason is that this would be an enforced payment. Everyone would have to do it. And I think that that's similar to the way that everyone was forced to pay for water. This isn't the right way to build public acceptance for a new way to finance a public service. And the third reason I say this is that it adds the cost of a company operations and profit onto an already expensive system. So here we would have to pay for the profits of an insurance company on top of our already expensive health system, the exact same way that we have to pay for the cost of Irish water on top of our water services. And the fourth reason is that it adds a lot of confusion into our health service. So now you'd have to choose between different insurance companies, different cover plans, and most worryingly of all, whenever someone in your family gets sick, you would have to negotiate with that health insurance company that might not necessarily want to pay for that for the cost of treatment. And the fifth and final reason I say this is that this is all talking about how we finance our health service, and it doesn't talk at all about the real root causes of why our health service is failing. And that's because we're not actually tackling how we improve the quality of our care and how we reduce the cost of delivering it. So there are lots of things that I would much prefer as a social democrat to be doing in our health service, like investing in primary care centres, reducing the cost of administration in our health service, getting a smart ambulance service, especially in rural areas, and tackling our drugs bill. These are all things that improve the quality of our healthcare and reduce the cost, and that's where I think we should be focusing our efforts.